Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent. The Farm, Food, and National Security Act of 2026 was passed by the House of Representatives on the last day of April and now awaits a Senate vote. This matters to rural health because of key provisions in that bill, which communities should encourage their senators to get to the finish line. One is the Rural Health Care Facility Technical Assistance Program Act, which will provide technical assistance and training for rural healthcare organizations to help maintain essential services, improve quality, and support long-term financial sustainability. Other important components of this bill include investment in rural broadband, loan and grant programs for rural behavioral health, rural workforce development, including healthcare and childcare, and rural nutrition and food security programs, as well as agricultural mental health. Unlike some other legislation involving rural hospitals, this act provides clear qualifications for how rural hospital eligibility will be determined. However, eligibility is largely subjected to the Secretary's determinations, and we must continue to lift our voices and advocate for rural hospitals supporting our nation's most vulnerable patients. Now on to the damage report. Historically, when patients have lost employer-sponsored insurance, they have transitioned to Medicaid when they meet the eligibility requirements. In 2026 so far, fewer patients losing coverage are enrolled in Medicaid. This translates to hospitals witnessing more uninsured patients, which adds to what we call bad debt, putting both patients and hospitals at risk as patients wait to seek care until their needs are emergent or urgent, and hospitals lose volume in profitable service lines that help maintain their margin. The expiration of the ACA tax credits is a clear source of this very shift. But other causes include immigration-related concerns and limited visibility into coverage status at point of care. For rural hospitals, consistency and reimbursement is vital, and disruptions like these can have irreversible damage on a community's access to care. We're already seeing this damage that is occurring across the nation's healthcare system as rural health is compromised in the name of eliminating so-called waste and abuse. And now for today's success story. Rural hospitals face some of the most intense financial challenges in our nation's history of healthcare. And more than ever, leaders must find creative ways to sustain their organization and to keep essential service lines open. A rural hospital system in Stroud, Oklahoma, has engaged in this very kind of strategy by expanding their inpatient care options to include swing beds, providing longer-term care for patients who are too sick to go home and yet ineligible for long-term care or rehabilitative care. This care model is also being deployed at rural hospitals in Texas and Arkansas. Models like this are evidence of how rural hospitals creatively sustain essential services while keeping their doors open for their communities. Thank you to our sources for this episode: the National Rural Health Association, United States Congress, Becker's Hospital Review, and Oklahoma Watch.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.